What brought me to healthcare, to understand Healthy Villages and understand my entrepreneurship in healthcare, you have to go back 37 years ago. My sister-in-law went into the hospital to deliver her second child. And in the course of her delivery, she died, having given birth to a baby. And she died because the physician who was attending her that evening did not have access to her medical charts. You may think that that was 37 years ago. So what? It doesn't happen today. And that's rubbish. 100,000 people in the US are killed every single day year because of medication errors, because the physician did not have the right information to administer to that patient. And that's what brought me into healthcare, an opportunity to see if we could bring technology and data and the passion to say that every single person has a right to a safe healthcare environment. And so 5 years ago, I launched Physicians Interactive. It was an opportunity to recognize that physicians wanted the information. They wanted to practice high quality medicine, yet they lacked the tools. And so many of us have said physicians will never use technology, and that's also incorrect. Physicians want to use technology, but they want people to understand what they do at the point of care. And so we got into the minds of physicians. We asked physicians, tell us what you want. It's very interesting. There are more than 20,000 medical apps out there today, yet less than 5% are used by physicians. And do you know why? Innovators develop for who and what they know. They're not physicians, and so they don't get into the mindset of physicians. And we actually got into the mindset of physicians. And what physicians asked us to do was to give them an integrated solution, not a single point of solution, but an integrated point of solution. And so we developed a medical app that resides on any device, that can be used on the iPad, that has an integrated approach to how physicians practice medicine. Now you may be asking, what does this all mean to Healthy Villages? Having developed this commercial business and having succeeded in proving its business model, I was appalled 3.5 years ago when the earthquake occurred in Haiti. And at that time, I was sitting on several boards. I was on the Regis College Board of Trustees, and I was on the leadership board for the Robert F. Kennedy Center. And I was frustrated as I was watching TV and as I was reading the newspapers that there were inevitably information that the healthcare professionals did not have in Haiti because of this devastating earthquake. And so we sent a dozen of our devices out to Haiti, preloaded it with the information that we believed would be appropriate for that devastating community. Weeks later, after using these devices and physicians and healthcare workers were accessing the medical content, we were getting reports back that we were actually saving lives, that healthcare workers were using the drug calculator to estimate how much drug dosaging should be administered to patients. That was terrific. And so I decided, why not go international? I believe, as the 25th Amendment of the Human Rights Act states, healthcare is a right for every single person, rich or poor. And yet 1 billion people will go to their graves prematurely, never having seen a healthcare official. I don't protest that we will change the entire world in my lifetime, but what I do believe is we can move the needle. And so Healthy Villages was born 2.5 years ago. We now have a pilot in Uganda, a pilot in Kenya, a pilot in Luwala, in China, in Louisiana, in Haiti. And we have demonstrated that a medical app can save lives. Let me give you an example. in Luwala. It's in East Africa, a community of 26,000 people. Each year, out of 1,000 babies that are born, 95 3 years ago died. Out of 1,000 births, 95 die. And they die because there is no prenatal care for the mother. And so, in partnership with the Luwala Community Health Center, we provided the medical iPads that had our medical content. And the community center went into the villages, identified the local villagers who knew that their next door neighbor was expecting. And they educated them on the reality that the community center could take care of them, that they could have this prenatal care. And so today, we have taken that 95 deaths per 1,000 births down to 35. 65 more babies are living. Just because you're poor doesn't mean that you're not smart. Just because you're poor doesn't mean that you don't have a right to the same services and health care that we have. And Healthy Villages has made a difference, one life at a time.